I'd like to welcome Dr. Emily Price to discuss hormones. So Emily is an obstetrician and a gynaecologist, and we really wanted to discuss how your hormones are affected in a pregnancy loss. And it is so different for every person. Your hormones just don't go back to normal straight away. Would you agree with that statement?
Thanks for having me, Peter. I absolutely agree with that statement. And I think that most people understand and appreciate that with a conception and a pregnancy that hormonal changes occur really quickly. But with the pregnancy loss, those hormonal changes need to be reversed. And there are certainly many symptoms that can be attributed to those hormones as they're starting to recalibrate.
There is a huge amount of symptoms that we could go through. But one of the things that we can talk about is that it can affect your energy, your sleep, even your appetite, your skin, your hair. Even if we look at your brain, hormones affect your brain. So there are so many symptoms that could possibly be occurring.
Yeah, absolutely. So I think, there are 4 main hormones that we think about when a pregnancy is occurring and hormones that rise rapidly in the first trimester, and they are estrogen, progesterone, relaxin, and HCG, or human chorionigonadotrophin. It's helpful if I can say it properly. And they have really important roles in early pregnancy maintenance. But they have lots of symptoms that can be attributed to them, and that might be nausea and vomiting, that might be skin changes, which can sometimes be skin improvement in terms of clearance of acne, but also worsening of acne, depending on the individual. They can be changes in hair thickness and growth and quality. So people often find that their hair is a bit thicker, partly because of the lack of hair fall. And also the hormonal changes related to, particularly to relaxin, around soft tissue changes and softening of the ligaments and joints and muscles that facilitate the physical changes that are required in pregnancy. And I think that the reversal of those effects of those hormones, depending on the gestation at which a pregnancy loss occurs, depending on the pre-existing hormonal status of the individual, depending on the age of the individual, the effect of that decline in those hormones that need to occur after a pregnancy loss has happened, the effect can be very different for the individual. It's really common for people to find that their cycle doesn't return immediately, and we can talk about what is normal for most people. But certainly as those hormonal changes are occurring, the usual diurnal, so day-to-day cycle, it's affecting their, as you said before, the sleep and wake cycles and their ability to focus and concentrate as the body is working really hard to heal and to recalibrate those hormones.
Yeah, and I think one of the biggest things with hormones is it's time. You just have to give it time. There's not really an answer to any of this. You will know by even when you had your period, the highs and lows you can have before your period, they may be occurring while this is occurring too.
Yeah, absolutely. And certainly we do see lots of women who recognise that they do have significant hormonal fluctuations throughout a menstrual cycle. And, it can be common for women who have more pronounced hormonal fluctuations to have, once again, more pronounced hormonal fluctuations after a pregnancy loss as well. And I think it can be tricky to talk to individuals about a timeline and the expectations after a pregnancy loss and when things might feel normal again, or normal for them again. But I think being aware that, yes, it is very individual and that is normal, hopefully is helpful for people to understand that it will recalibrate. As I said, I think it does depend a little bit on the gestation at which a pregnancy loss occurs, and certainly thinking about later pregnancy loss into the second trimester particularly, that some women can have other hormonal fluctuations that are surprising to them in terms of the effects on their breasts and potentially the effects on their return to cycle, which can be a bit more delayed for women who experience a pregnancy loss in the first trimester.
The other thing that comes into it is that you have had a loss, so you can be grieving or you will be grieving, and then to have your hormones all over the place. We already know when your hormones are all over the place during the period, it can be really hard to deal with. So dealing with it with a loss can also heighten those emotions.
We certainly find that the biggest hormonal drop occurs in the first few days after a pregnancy loss. And, that's when there's the acute grief and emotional processing that's going on, usually for most individuals at the same time. And so these things are happening simultaneously. So it's a time to really to lean into it and to lean into your support network to be able to just ride that wave and then allow that healing to occur afterwards.
Thank you so much for talking to us about this. It's just something that I don't think we talk enough about, and I think we need to talk about hormones with women through all periods of their life.
Absolutely. And I think that just to touch on another area is that return to normal cycles and normal menstrual cycles, which will be variable for every individual going through a pregnancy loss. And it's a common question that I get is, when will my cycles resume? And certainly, my usual explanation is that certainly within about 2 to 3 weeks, hormonal levels will approximate baseline, and usually the pregnancy hormone or HCG level has returned to negative, which releases the handbrake that has been put on the menstrual cycle hormonal shifts. And so those menstrual cycles will usually kick back in. And so the next normal period after a pregnancy loss is usually within about 6 weeks of the pregnancy loss, assuming that there's not been any complications or persistence of the HCG levels.
And so if a woman doesn't get her period back, would you recommend she gets it checked out?
My recommendation usually is that if a woman hasn't had a period within about 6 to 8 weeks of a pregnancy loss, that they seek review with their care provider, just to make sure that there's no, as I said, hormonal persistence that might be causing their hormonal levels not to have recalibrated normally and their cycles to have resumed, but also within the context of what their cycles were like previously. So if they previously had some cycle irregularity or had usually prolonged cycles, then this may be within the spectrum of normal for them. But if they're someone who's typically had very regular monthly menstrual cycles, then certainly if they're not having a period within about 6 to 8 weeks of a pregnancy loss, then seeking assistance from their care provider and an assessment would be a good idea.
And when their period comes back, does it always come back the same as it was, or can it be heavier and lighter?
Yeah, unfortunately, once again, everyone is different. And certainly we do see that for some people, the first period after a pregnancy loss can be a bit heavier. That may be related to any pregnancy tissue that has persisted, and certainly any other procedures that may have been required as part of their their miscarriage care. We would expect that the majority of people shouldn't have periods that are lighter than they were previously. And if there's a persisting change in the volume of menstrual flow after management of a miscarriage or a pregnancy loss, it's certainly an indication to seek review with their care provider, whether it's their GP, midwife or obstetrician gynaecologist.
Okay, thank you so much for that. It's really good to just get that out there.
Absolutely. Lovely to chat, and hopefully this is helpful.
Thank you.